Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about patient admission. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with likes and follow. Application. This policy is applied to all hospital employees involved in admitting patients. The purpose of this policy: 1. To ensure a smooth admission of patients to the hospital. 2. To set guidelines to be followed whenever a patient is to be admitted. 3. To provide the highest possible level of quality service to internal and external patients upon admission. Definitions. Admission is the process of hospitalizing the patient for observation, investigation, treatment, and rehabilitation. It's a formal acceptance by a hospital to a patient who is to receive medical care while lodged in the hospital. Eligibility is a patient classification that can avail or not of free hospitalization service benefits. Policy. Number 1. All patients for admission, either from outpatient department or emergency department, must pass through admission and discharge office for proper eligibility screening and admission procedure. Number 2. A patient is admitted according to A. Emergency admission. Emergency cases ordered by the doctor to be admitted through ER immediately, regardless of eligibility. B. Elective patients. Patient's condition is stable and can be admitted through OPD as scheduled by appointment office. Number 3. Patients for admission should fill up a consent form for admission and discharge, as well as consent for the diagnostic, therapeutic, invasive, and any surgical procedure. Number 4. All patients should be admitted in a timely manner, unless there is a clinical reason for prolonging the stay at the point of admission. Number 5. All patients admitted with personal belongings and valuables that they have brought to the hospital should sign a general consent regarding safekeeping of their valuables. Number 6. All patients admitted should have a medical record number. If a patient has no medical record and needs routine admission, the patient is instructed to open a medical record file in the registration office in OPD. The appointment office will then call the patient by phone and inform him or her about the scheduled date of admission. Number 7. Admission of patients to the ward or unit is based on the decision of the attending physician according to the clinical condition of the patient. Number 8. As much as possible, all urgent laboratory, X-ray, and diagnostic procedures must be done and should be collected prior to the patient's transfer to the wards. Number 9, all admission papers should be completed as soon as possible at the place of admission. Number 10, pediatric cases for admission should have a voucher. Non-availability of an attendant should hinder admission to the ward except ICU and ICU admission. Number 11, handicapped or geriatric cases for routine admission should have a specified attendant given to the appointment office. Otherwise, no admission schedule should be given. Procedure. Number 1, patients arriving in the hospital with acute or chronic medical distressing conditions are seen in the emergency room. Number 2, initially, these patients are seen by ER doctor, and after initial treatment, the patient may require to be admitted for further investigations and treatment. Number 3, following such examinations, investigations, and occasionally as an emergency, patients may be admitted to the ward. Number 4, before admission, the routine investigations like CPC and urea and electrolytes should be done for almost every patient, in addition to the following. Number 5, prior to admission, the admitting doctor should discuss with the patient or patient's responsible adult the nature of treatment and its possible outcome, necessary papers and consents. Number 6, medical record officer is contacted for patient's medical record if the patient is a readmit case. Number 7, bed management officer is contacted to arrange bed and its availability before admission. Number 8, children are normally admitted to the ward with voucher. In cases where pediatric ward is full, children are admitted to female ward with the mother or any responsible female voucher, or if with male voucher in a male ward for a short period of time. Responsibility. It is the responsibility of all patient staff working in the hospital to implement all policies and procedures for admission of patients. It is the responsibility of the admission clerk to collect patients' demographic data, prepare the admission paper, and attach copy of patient's ID with the admitting papers. The patient relation officer should be responsible for getting the patient or watcher to sign admission consent form. When surgery is anticipated, he should also be responsible for ensuring that appropriate surgical consent is obtained after proper explanation of the procedure by the surgical doctor. Role of the admitting nurse. To check that all doctors' and nurses' notes have been completed and consent for admission is signed. Give and endorse full report of patient's diagnosis, condition, treatment, and investigations done to the receiving nurse in the ward. Inform the admitting clerk which ward and what bed number the patient has been admitted to. It is the responsibility of the admitting clerk to input this data into the hospital internet. Transport the patient to the ward using wheelchair or trolley depending on the condition of the patient, and give full verbal report to the unit nurse with regards to the doctor's order and what treatment has been given. Role of the admitting doctor. Complete the admission papers at the site of admission or as soon as possible after admission to the ward. Order all necessary tests and review the results as soon as available. Explain to the patient and the family the reason for admission. Document any surgical procedure to be done on the consent form and assist the patient relation officer in explaining this to the patient or family before obtaining the consent for the required surgical procedure. Brief treating consultant about the patient's admission and invite him or her to review the case in ward or in the ED as dictated by the patient's presenting problem. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Attachments of this policy are: number one, admission forms. See assessment and reassessment of patient forms. Number two, progress notes. Number three, doctor's order forms. Number four, surgical consent forms. And number five, nurse's notes. See nurse's assessment forms. Thank you.